Assalamu alaikum. The communication day. First scenario. Mr. John Smith, 65 years old, has a malignant melanoma that was removed 6 years ago. Recently admitted with pleural effusion. CT scan has shown multiple nodules and pleural effusions. Pleural fluids was drained, sent to the lab, but not examined because it was labeled wrong. Mr. John is now asking about his result and his CT scan and pleural fluids result. Please talk to him and address his concerns. If you're ready, Dr. Najla, we can start. Dr. Salma?
Okay.
Yes, I'm ready.
Okay, here you go.
Hello.
Hello.
Hi, I'm Dr. Sadiqa, one of the doctors working today. May I confirm that you are Mr. John Smith, 65 years old?
Yes, I am John.
Hi, Mr. John. So today I would like to discuss with you about your health condition, and I'm happy to answer all your questions and concerns. Is that okay with you?
Yes, go ahead, doctor.
Okay, so Mr. John, just to be on the same page, can you please tell me how far you know about your condition?
Okay. Um, I came here yesterday because I was having shortness of breath, chest pain, and the doctors admit me, and they said that I am having fluids in my lungs, and they took a sample from this fluid. They took the fluid out of my lungs, and they did also a scan to my lungs. So I'm here today to know the results of the scan and the fluids. Although I am okay now.
That's okay. That's good that it's good to hear that you are okay, Mr. John. So just before discussing the result of the scan, uh, do you have any like specific concern or any idea about what is going on with you?
Yeah, I told you, doctor. I just want to know the results of my
Mm-hmm.
scan and my fluid.
Mm-hmm. Mm-hmm. Okay. Okay. Mr. John, I'm sorry to tell you that I don't have a good news for you today.
Why, doctor? What's
Um,
going on?
Actually, the result of the scan is not what we hope. I'm sorry to tell you that the scan shows that you have some multiple growth in your lungs and the fluids in your lung as well, and that's why we take some of that fluid from your lung and send it to the lab. But when I contacted them today to know about the result, they mentioned that the result is not received by them. So it seems that your sample is labeled wrong. So I'm sorry to tell you that, Mr. John, I am not able to, we don't have the result of your fluids as far.
Oh my God. So uh,
Mhm.
that is a shocking news.
I'm
So
really,
are you aware that I have a skin cancer before?
yes,
So,
Mr.
so
John,
you
you.
are so you are telling me that maybe I have something again in my lungs?
I'm really sorry to tell you that, Mr. John, it is a possibility which we need to exclude. We are not sure yet, but we need to the fluid test might give
I'm
us a
sorry,
lot of
doctor. I'm sorry,
answers.
doctor. But how can you be sure while you lost my sample? How can you be? That is a stupid mistake. How
Yeah.
can this happen in this hospital?
Yes, I am apologizing, Mr. John. What had happened should never happened. It's a mistake, and I'm apologizing on behalf of the team. And we already did some actions regarding what had happened. We informed our consultants, and we are investigating what happened, and we informed a team that is specialized in
Management risk team.
risk management team specialized in dealing with such conditions, called risk management team. So they will investigate what's going on, and they will I'm happy to update you about the report or the result of this investigation. um I'm really sorry, Mr. John.
What I will do with your risk management team and so on, so on. Just tell me, doctor, are you going to take the sample again from me?
Exactly, Mr. Jones. That's what I was about to tell you. Regarding the risk management team, it is just and the reports and everything that the medical team, we as a medical team, used to do in such condition is just to improve the quality of our work, and just to make sure that what happened to you, because it is uh, uh, um a fault of the system. We are just trying to make sure that this will not happen to anyone else. But from now, what we should do now, I'm really sorry to tell you that we need to take the sample again.
So, are you going to take the sample again?
Yes,
Is there
please.
is there still fluid left in my lungs to take a sample?
We can do it like through jelly scan. We can do a jelly scan and just check about the right place to take the fluids, where the fluids collected, and we can just take a fluid from your lungs again to be sent to the lab. It's very important to do this, to get the result of this sample, Mr. John, just to go
So you're
forward.
saying that there is no other options to know what is going on rather than taking a sample again.
I believe in your condition, it is the best option for your case. There is any other options, we can discuss later, if after the result of the sample.
Okay, so uh, doctor, just let me know
Mm-hmm.
because I was planning to flying to Australia to witness the wedding of my daughter. So
Oh,
if you do what you want to do today, and please release me to go to witness this wedding because you are saying that maybe I am about to die.
sorry, Mr. John, who told that you are about to die?
Yeah, well, regarding the situation. So can I go can I fly like today or yes or tomorrow?
So, Mr. John, first of all, congratulations for your daughter and for the happy
Thank you.
events going on in your family.
Mhm.
Regarding flying, I will discuss with my consultant regarding are you able to be flying or not. I believe they will not be, if you are feeling well in yourself. I believe it's okay. It will be okay for you to do it, but it is important for us to take the sample. So just to find out what is going on for you, and to put the right management plan for your condition, just to find out why this fluid's collecting, and what will be the next step for your management. Is that okay, Mr. John? Are you happy for us to go forward and take the sample again?
Can you please tell me who did this mistake at least? I just want to forward the complaint. Do what you want to do about this risk management and blah blah, but
Mhm.
just let me complain against this person.
Okay, I understand. I understand your frustration, Mr. John. It's really, anybody in your shoes would should be do the same. Like it's really frustrating.
Mhm.
But it is a fault of a complete system. It is not. It is a fault of the team. It is not a one person fault. Um.
2 minutes
So
left.
yeah, so it's just a fault of the team, Mr. John. It is not about one person who did this. So I'm apologizing on behalf of them again, and please accept our apologies, and let's take this situation forward. Um, and your health is our priority, and we are just all concerned about your health.
So you are defending your colleague.
I'm not defending my colleague, Mr. John. I'm not here to defend anyone, and I'm happy to guide you patient liaison service, advisory and liaison service, if you would like to formulate a complaint. I'm just explaining to you the situation. Maybe you will see it from another perspective. But if you are insisting to complain, I'm happy to guide you. And I just assure you that this, if you raise a complaint, it will not affect your management or your care that you will be provided by the whole team. Are you following me, Mr. John?
Yes, yes. So you are going to give me the contact number or guide me to them,
Yes,
right?
yes,
Yeah,
yes.
thank you,
My
doctor.
pleasure.
Thank
Yeah,
you.
yeah. So, Mr. John, do you smoke?
No,
Do you drink alcohol?
occasionally.
Occasionally. So, Mr. John, are you happy for us to go with the forward with the procedure? Are you happy to sign a consent for the procedure?
You mean taking
Another
again a sample?
sample? Yes, yeah,
If it will help clarify the diagnosis and let me go to to the wedding of my daughter after that,
yes.
yeah, I will sign it. Although
Okay.
it is very painful. Yes, I will sign it.
Sorry for that, Mr. John. I will reassure. I will try to. Uh, we will try to make it less painful as much as we can, like by numbing the area and use by numbing the area and give you uh, the suitable painkiller afterwards. How this sounds to you?
Yeah, that sounds good. Great. Thank you, doctor.
Okay. Thank you, Mr. John, for speaking to me today.
Time is up. Thank you, Dr. Najla, for practicing the case. And thank you, Dr. Salma, for the scenario. Let's hear the comment first, then I will comment. Can you start, Dr. Salma, please?
Okay, thank you, Dr. Najla. As usual, mashallah, you are very, very, very good. Your approach is very good. And what is very good in your approach that every time you are praising the patient. Good to hear that you are okay. Congratulations for your daughter. I heard before that this will cover every pitfalls that if you did any pitfall because the examiners will be very happy that you are a good communicator. And so thank you for that. And the other thing that you get that this is a mistake and you activated the duty of contour, admitting, apologizing, and action also. Although I have some comments on the action, okay? Firstly, try always to fill the gap of knowledge. The patient told you, don't you know that I have a cancer before? Why this happened? Because you did not in the
Yes,
beginning tell him, yeah, and I know that you have skin cancer 6 years ago,
yes.
which was removed by surgery. If you said this word, he will know that you know everything and he will trust you more. This is number one. Number two, the action. Actually, here in the scenario, the pleural fluid was drained, so
Mm,
there is no pleural fluid to take another sample.
mm,
Uh, so the action, he has multiple nodules in the scan, which might indicate a metastasis.
mhm.
So something should be done. So you should mention to him you have two options. Either we evaluate your condition again and see if there is any other fluids in your lungs to take a resample. The other option is taking a snip from the lesions in your lung that appear in the CT scan.
Mhm,
Uh, anyway, the action not completed yet. The action should include the multidisciplinary team. So you will mention to him anyway, you will be under the care of a multidisciplinary team who is containing multiple specialists who is going to re-evaluate you and come up with a suitable plan for you to complete the investigation and to make sure what is the diagnosis, and then they will sit with you and discuss the further management plan. This is the action. You have two actions. The first action is the medical action, which I discussed now. The second action, actually, you master it. That
mhm,
is, yeah, that is the quality improvement action. we inform our seniors and the doctors. We raise an incidents report or a report about the incidents that happened, because let me just tell you that we need to improve the quality of control, and we have here a system in the hospital and a department called the risk management department. They are concerned about investigating any incidents that happen in the hospital and find out what is the problem. And the third thing, and then we will set a meeting to discuss the results of their investigation to improve our quality in order to prevent this from happening in the future. This is the second action, and you did it very good. Actually, there was a concern when I heard this scenario from the mentor. He did not raise this concern, but I added because I find it somewhere that he want to fly. Blu-ray fusion is just like pneumothorax, as I heard. Correct me if I'm
Oh.
mistaken. Yeah,
Mm-hmm.
he need to be reevaluated, and he can fly after 2 weeks. When you tell him like that, he will tell you, I need to go to the wedding. It's very important, like this, and then you will suggest for him alternatives like the media. They can open the media for you to be in the wedding, but your health is a priority, and you are precious to your daughter like you are precious to us, like this. Just Dr. Basim and others, correct me if I am mistaken, but I think pleural fusion is also like pneumothorax. He needs 2 weeks to fly, right?
Yeah, thank you, Dr. Salma. I don't know about really. I don't think it will be need to be stopped for flying because
Mm-hmm.
it's just tapping. So it's not air or
Mm-hmm.
it's not something pathological. We did
How
ultrasound
come?
guided, so it's just snip and it's just needle. I don't know.
Actually, yeah. Actually, it's
I
first time for me to think about it. We
Yeah.
need to recheck it out. But
Yeah,
when I
we
answer
need to
it, I'm
recheck
just
it.
like,
Yeah.
yeah, pneumothorax
Mm.
is like the pressure changes while
Yes,
flying, and
exactly.
those
It's
things will
air and
increase
fluid.
worsen the things. Yeah,
Mhm.
but the fluid,
Mhm.
it's really like no, we need to search it out to
Yes.
I
find
think
out.
I'm reading here from BMG that with the recent onset of pleural effusion, investigation should be done, and air travel is delaying within 2 weeks. But you
Mm,
need to
okay.
check the NHS also. We need
Mm-hmm,
to check the NHS also.
mm-hmm.
Anyway, if you are yes not sure about, you can postpone and tell him I will read about this
I will
guidelines
read. That's
and
it.
the airlines
Yeah.
regulation, and I will update you about. It's
Dr.
first
Basim,
time to hear about that. Yes.
you just took it from my tongue. I want to tell Dr.
Yeah.
Najla, whenever you are not sure about anything,
Yes.
Yeah.
Exactly.
I hear Dr. Hussein before, he said, when you are saying to the patient this sentence, I'm sorry, I'm not sure about the answer of this question, but I
Mm-hmm,
promise you, I will look and ask my seniors about this, and I will come back with an answer for you after
mm-hmm,
this meeting. The
mm-hmm,
examiners will consider you like you answered the concern. خلاص.
mm-hmm, mm-hmm,
Yes.
mm-hmm, mm-hmm.
I agree for this. Yes.
Don't jump into just guessing. You
Yeah.
answer this clearly, you will get the full mark.
Mm-hmm, mm-hmm, mm-hmm.
Perfect.
Okay?
That's good.
Yeah.
Okay.
That's good.
Thank you. Yeah. Thank you,
That's
Dr.
it.
Salman. Yes.
Yeah, and the sentence of pleural fluids was drained. Is that means it's completely drained? Is that what do you want to say?
Yes, it's completely trained. This sentence put in this scenario
Mm,
specifically to hint for you.
Uh-huh.
And also, I want to tell you something, Dr. Najla. They
mm,
didn't mention in the scenario break to him that you are going to take a resample.
mm,
Yes.
Yeah,
they yeah.
they mentioned just address his concerns and discuss with him the further plans. So you
Mm-hmm.
should be caution. You
Cautious.
are mentioning something, yeah, very cautious, because you will mention to him. They will the multidisciplinary team will reevaluate you again, uh, although you have options like taking a snip from it. They can do
Snip from
bronchoscopy
the. Mm,
and take biopsy, and
mm,
they can do a lot of things. So you just you don't know what they are going to do. Just
mm,
reassure him. Okay.
mm-hmm, mm-hmm. You are absolutely right.
Perfect. Thank you, Dr. Salma.
Okay.
So,
Yeah.
my comment on Dr. Najla, performance is of course great, but we have three lessons from this scenario. Okay,
Mhm,
this
mhm,
is in general and for all.
mhm.
First lesson, starting from the last point Dr. Salma mentioned, don't judge on the scenario as you read it before and you do it
Yeah.
as
Mhm.
the one you know. Okay, this is the first lesson and it's very important. Now they are playing with the sentences inside each scenario from center to center. Yeah, the idea is same, but they are usually changing even one word, it might change the whole scenario. As Dr. Salma said, in this scenario, they said they didn't mention either to withdraw or to take another snip. So stick to the scenario, read what written, and check what he will tell you. This is the first lesson, okay? The second lesson, in any mistake, medical error, in any scenario, please focus on the medical side of correction. Don't talk about the administrative and the non-medical correction first before mentioning the medical. So in this scenario, the first thing you have to do to reassure him, we are sorry, of course, apologize, but we will do and we did an action immediately and we will try to finish this process as soon as possible in order to finish your management plan as soon as possible, of course, with our expert team. What you mean, doctor? So we will sit with the team again. We will reassess you. Whatever you need to do or we need to do from you, we will do it as soon as possible in order not to waste time. Try to make him reassured by your steps. I mean, the medical steps. Leave the non medical now. Okay. Later on, you can tell him, yes, plus, in addition to what we did, we have another action called the incident report, the root cause analysis. By the way, it's not risk management here. It's root cause analysis because the mistake happened already. The risk management, when the risk might happen. It's something to prevent, but it already happened, so root cause analysis. Okay. And in order to improve our quality and to prevent this mistake to happen to other patient or to you or to another patient in the future. But always reassure him about his steps, his management plan, what we will do with him now. Leave the quality issue or the legal issue. Okay. This is the second lesson. The third lesson, I prefer any patient or anyone talking to a patient and he want to take approval of agreement for any procedure, I prefer to say, are you agree with this? Do you sign the consent? Are you okay with this? Rather than saying, are you happy with this? Or if you're happy, let's do. Because no patient will tell you, yes, I'm happy. Maybe this word might irritate him more and he will tell you, do you think I'm happy if you will do this procedure again? Okay. Sorry, Dr. Najla, this word because you repeated it again, so I want you to just to replace it with
Yeah, Dr.
better.
Basim.
Yes.
She
Yeah.
used it also in another situation I wrote here in my paper. I
Mhm.
am happy to guide you to the pulse.
Exactly. Yes. If
Yeah,
you're happy, he will
yeah,
not be happy. Yes.
yeah. You should say, Dr. Najla, I am sorry. I am sorry that the situation went to this point. He want to complain. You are not happy. You are sorry. I am sorry that the situation went to this point, but make sure that I will guide you to the pulse and I will give you the contact number of them. And make sure that it will not affect the care and management and treatment that you are getting with us. That's you are not happy to guide him to the pulse.
Yeah. Even the
Mm.
approved approval from him. Are you agree with the procedure again? Are you
Yeah.
agree to process or to proceed? Don't mention any happy in or happy. The word itself might make him irritated, and he will tell you, Doctor, do you think I will be happy to sign this form and to prick me again? And I think it will affect the welfare if you mention it. So, are you agree? Is it okay at all? Don't say, are you happy or I am happy. No happiness at the scenario or any communication scenario, totally. Okay. This is my comment, but you did, apart from that, you did great, Dr. Najla. And really, I appreciate being practicing although no one volunteered for that. You know what, Dr. Najla? Believe me, in the day of the exam, when you face a scenario, you will regret that you didn't do the scenario previously in the training.
Mhm, mhm,
But any scenario you do it in the training days or in these sessions, if you see the scenario in the exam, you will feel very comfortable that I already practiced this scenario before. I can do it easily and by too much confidence.
mhm.
I,
Thank you very much, Dr. Hussam. Thanks a lot for the guidance and corrections. I will keep your advices
no worries. You deserve the best,
right
inshallah,
correct.
Dr. Najm.
Thank you very much. Thanks a lot.
Okay, you have a scenario now for Dr.
Yes,
Salma?
yeah. So I will try to share it here. It's
Yes.
an just a screenshot.
There is a question from iPhone. In this case, no chance for second tap. What is the plan for this page? So, as Dr. Salma said, there is another option either by taking bronchoscopy guided, CT guided, but don't mention, just say we can reassess the amount if it is okay enough to get a snip from it, or we can do another procedure, or we can do an image to see how is the situation. It's up to the next image. So don't make it as one step to do, because it's not mentioned here. There is alternative step. Okay, as Dr.
Yeah,
Selma
yeah.
said.
They didn't mention any step or
Yes,
suggestion.
exactly.
Yeah.
Yes. Okay, so this is your scenario, Dr. Salma. Speak communication candidate information. Speak to Mr. White, son of an 80 years old lady, Mrs. Margaret, who was diagnosed with esophageal malignancy. She initially presented with, or about 7 months ago, with vomiting and hematemesis. She was admitted to gastro ward and had endoscopy, which showed gastric and duodenal erosions, and was started on PPI. Because her symptoms were ongoing, an abdominal ultrasound and chest X-ray was done and had repeat endoscopy arranged by GP, which showed no evidence of malignancy on the biopsy. As her condition continued to deteriorate, she was admitted 3 days ago and had a CT chest abdomen, which showed circumscribed growth surrounding the esophagus at the level of the carina, along with lymph nodes suggestive of metastatic spread to celiac nodes and spleen. Son is very upset that there is delay in the diagnosis of cancer and wants to speak to the doctor. Your task is to explain the finding and discuss about further management and address his concern and as appropriate. So it was a scenario about mass and spreading, and let's see how Dr. Salma will do it. I will give you 2 minutes. Just let me know if you're ready, okay? Any question for the previous scenario?
السلام عليكم دكتور باسم.
عليكم
And
السلام
all.
ورحمة الله.
Yeah, well done, Dr. Najla. I just have one comment. At some point when she was explaining the results to the patient, she said, today when I contacted the lab, they told me that the results were not done or something. So it seemed like that it was not her fault, it's the lab's fault or someone else's fault. So I think um, it's better to say it in another way, like the results were not done or we could not do the results, rather than saying the lab told me or someone told me.
Yeah, I got your point. So you mean don't mention a specific step in the scenario or in the process,
Yeah, don't blame
as it's not
someone.
written. Yeah, don't
Yeah,
blame
yeah,
someone, and as it's not written. Exactly. Yes.
not written, yes.
Mm,
Yeah. So do whatever written in the scenario exactly. If
mhm.
written, the lab or the result wasn't released or wrong released, or whatsoever written in the scenario, stick to the plan. Yes, as you
Yeah.
said, yes, you're
It's
right.
just a little confusing, Dr. Basim. It's just when you read the scenario, you need to suggest a management plan, which is sometimes is not written in the scenario. I mean, like they are looking to your judgment, like clinical judgment in somehow.
Yes, yes.
But at the same time, it's just like it's really challenging. But yeah,
Y-
we need to try as much as we can to stick
Yes, you're
to.
right. You're right, Dr. Ryan. By the way,
Mm.
you might have a scenario which is not clear for you. You
Yeah.
might sit with a surrogate, he's not also clear with you, and you don't understand what he's saying exactly and what the words he's saying and what's
Mhm.
the relation between his expression and the scenario. Be ready for any
Yeah.
situation.
Mm.
And this practice make you ready for any situation, either wrong or angry surrogate or misunderstanding, miscommunication. Believe me, you might have a clear scenario, but the inside, the surrogate, might talk as something different totally about the scenario. You got it?
Yes. Yeah. Yeah. Yeah.
So you're right, Dr. Ryan. I hope we can learn from the sessions how to communicate and with confident way with any type of surrogate. Hopefully, inshallah. Hidden agenda, of course. Always you have agenda, a hidden agenda. You might prepare something, and inside you will face another situation, another plan, another query, another doubt by the surrogate, and you have to be ready for this question, how to answer it immediately. By the way, you will have subconscious answer. I appreciate and answer it without being quiet for single moment. Because if you stop to think, I think they might fail you in this scenario. You have to be fluent in every question. Yes, exactly. Thank you. Are you ready now, Dr. Najla? Let's start. Dr. Salma?
Okay.
Yes.
Hello.
Hello.
Yes, this is Dr. Abdurrahman, the doctor in the ward today. Can I confirm your name?
I am White. I'm White, Mr. I'm Mr. White, doctor.
Mhm. And are you the son of Mrs. Margaret?
Yes. Yeah. 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 She's 80 years old. Yes, I am her son.
Okay. So, Mr. White, are you the next of kin of Mrs. Margaret?
Yes.
Okay. So we are here today to discuss some issues regarding your the health condition of your mother. Before starting to discuss these issues, can I come to know how much do you know about the condition?
Yes, doctor. Actually, my mom is being poorly for the last 8 months.
Mhm.
And she's here in the hospital for the last 3 days now. And she had images, and I'm just wondering what is going on with her. Just waiting to know about the result of her images.
Okay. Okay, Mr. White. I'm so sorry for what is your mother going through.
Mm-hmm.
And yeah, I come to know that she presented before 8 months and some scan done for her, and she put on treatment, but she was deteriorated, and she came again to the 3 days ago, and a scan done for her. So,
Yes.
can you tell me exactly what do you expect from our meeting?
Actually, I'm expecting answers, doctor, because
Mm-hmm,
I thought, as I mentioned, the condition is ongoing for the last 8 months, and my mother is really suffering from
mm-hmm,
vomiting blood, and then aches and pains, and a lot of
mm-hmm,
images and camera scans, and nobody had answers for what is going on with her. So
mm-hmm,
I'm hopefully for those answers. Uh,
mm-hmm.
yeah, to hear those
Yeah,
answers today.
Yeah, again, I'm so sorry for what happened to your mother. So, Mr. White, the results are here with me now, but unfortunately, I'm so sorry to tell you that I don't have a good news for you.
What do you mean, doctor?
Mhm. I believe that you are aware that the GB, when he did the endoscopy and biopsy, he told you that your mother is having a malignancy in the esophagus. And as a result, we did the CT, the scan, the images for her chest and abdomen. And unfortunately, the scan confirmed this and confirmed that her cancer, which is in her food pipe, metastasized now and spread to other places. Um, uh, I'm so sorry for that. I'm so sorry for that. Did
Sorry,
you get
doctor.
it?
What malignancy you are speaking about? Um,
Mhm,
the GB mentions that there is no malignancy, no cancer. There is no cancer. When she had the camera test, they
no
assured
evidence.
us that there is no cancer. How come you are
Mhm.
telling? Are you mixing up my mother's result with someone else, doctor?
Mr. White, I appreciate your concern. I know how this news would be devastated and very hard for you. And anyone in your shoes would react it the same as you. But unfortunately, yes, the city, what we did now, confirmed that she has a cancer in her esophagus that missed before, and now it is spreading to other parts of her body. I'm so sorry to tell you that. I'm really sorry about that.
Just 1 minute, doctor. Are you telling me that the GB know about the cancer and they didn't tell us, and they didn't manage her until it spread? Is that what you wanted to tell me?
Mr. White, your concern is valid, and but I didn't tell that. I didn't say that. I was not with the GB at that time, and I need to. Maybe there is misunderstanding between you and the GB. I need to contact the GB to make sure. But sometimes this kind of lesions could be missed if not interpreted by a person who is specialized in the reading these scans. I need to contact the GB again and clarify the situation with him, and then I will talk to you about this afterward. Uh, Mr. White, do you want me to explain to you further what shall happen now?
Okay, doctor, go ahead.
Okay. Thank you, Mr. White. So now your mother will be under the care of a group of doctors. These doctors, this group consists of the gut doctor, the cancer doctor, specialized nurses. They are all going to sit with her and re-evaluate her and set the plan of management, and then they will going to update you further about that. Um, and make sure that she will be under our care, and we will provide the best care for her. Are you following me?
Yes, doctor.
Mhm. So, Mr. White, can I ask you some questions?
Okay, doctor.
Okay, so with whom your mother is living now?
She was living with me.
Okay, and are you financially supported? Do you need any help from us?
No, I'm fine, doctor.
Okay, that's great to hear. So, Mr. White, I'm so sorry for what happened to your mother. And as I discussed with you, we are going to investigate further about this situation, contact the GB, and see what happened with her. The first steps that she went through, the first scan shows some lesions and treated accordingly, but it wasn't cancer. And then after that, what happened in with the GB, we need to investigate this further, and then we will come back with you. And now her situation, as I discussed with you, she will be under the care
Two
of
minutes.
under the care of the group of doctors who are going to take good care of her. So, are you okay with this plan?
I'm just wanted to know, doctor, like what, because I believe the GB delayed the diagnosis of my mother
Mhm,
condition,
mhm.
and now you are telling me that the GB knew that she had a cancer and they didn't inform us. So
No.
how you are?
I'm sorry, Mr. White. I told you that we are going to investigate further and contact your GB to know about what happened. We don't know. Of course, in our practice, if the doctor just feel that there is a possibility of cancer,
Mhm,
he would not delay the diagnosis. He would not delay the treatment.
mhm,
This is what we do in our practice. So based on that, we need to recontact your GB and make sure what happened at that time, and know where is the problem. Yes, the diagnosis was delayed, and I'm so sorry for that. And this needs to be investigated further, as I promised you. And we are going to investigate this further and clarify what actually happened. Okay.
mhm, mhm. Okay, doctor. Okay.
Mhm. So, do you have any further concerns?
No, doctor. Thank you very much.
Okay, thank you. So I'm going to give you some written brochures and websites to know more about the situation and condition of your mother, and make sure that we are here to help her, and we are not going to leave her throughout this journey from now on. And she will be under a good care of our doctors and hospital. And we apologize again in regards of all the hospital team and about what happened to your mother. And hopefully we will correct it from now on.
Thank you, doctor. Thank you very much.
Welcome.
Okay, thank you, Dr. Salma. Well done. But
Yeah,
let's hear the comment first.
this is a medical error from the GP. I don't know.
No, I don't think. Let's
Why you
hear.
are saying it
Yeah,
is a medical error from the
exactly.
GP?
It's written in
Why?
scenario clear. No
Is it?
cancer.
Yes, it is
No
not a
evidence of
medical
But
cancer.
error.
it's
Yes.
not about no cancer. It's about he should, يعني, when you are, there is erosions in the esophagus.
Uh-huh.
So we need a follow-up plan. So we don't know if he make a follow-up plan for, and I didn't tell medical error at all. I avoid that. But
I-
the thing that the consequence of what happened was devastated. So we have to be sorry.
yeah, but you have to be sorry for what happened to the mother. But
Yes.
from what you didn't mention it clearly, but from the way you treated the condition, the situation, it seems like, correct me if I'm wrong, but it seems like
Mhm,
as if you are blaming the GB because you didn't wait it for me to raise the issue of that. I feel the GB delayed the diagnosis. You straight away mentioned that we will investigate what happened, and we, as if the GB did wrong.
mhm.
But if you look to the scenario is lengthy and there is a lot of details in there. But
Actually, I
yeah,
didn't see no evidence of malignancy.
yeah.
I didn't see no
Evidence of
evidence.
malignancy, no.
Yeah,
That's why
yeah.
I got you.
Showed evidence of malignancy. That's what I
No,
saw for
no
firstly.
evidence of malignancy. So what the
Yeah.
GB did and what she had all through this 8 months, I believe
Mhm,
it was the right thing because she came with hematemesis. She had endoscopy and
mhm,
it there was erosions and people I prescribed. This is proper. And then
mhm, Mhm.
symptoms ongoing. She had abdominal ultrasound and X-ray, and
Mhm.
then endoscopy done, a biopsy taken, again no malignancy. So what is,
Mhm.
and then her condition deteriorated, so she had the CT. Maybe the
Mhm.
only thing that the son will be angry about is why this image delayed up to now, why this image not done before. But you,
Why the referral not done also before?
what referral? She was seen by the
Mm.
gastro team. She was seen
Mm.
by the gastro team and had endoscopy
Mm.
before. So the referral
Mhm.
was done before. And now she came to
Mhm.
the hospital because she deteriorated. But the CT, like the son will raise the concern, why is this image not done before? Although
Mm.
she had, and then you will answer, she already had the proper investigation at the time of her illness, like she had the
Mm.
endoscopy and she had a again endoscopy and another biopsy and everything. So the course of her condition is, I believe it is the right thing. But
Mhm.
and afterwards, when I mentioned that I believe the the GB delayed the diagnosis, then you can mention, we can discuss with the GB and see, and see what, like, we'll discuss about the condition and see what is the justification for that. But from what I see, it is your mother had the proper investigation to, and you mentioned that this cancer sometimes is difficult to be identified and sound and everything,
Mm.
and
Mm.
it is surrounding the esophagus from outside. So maybe this is why it is missed.
Missed, yeah.
Yeah.
Mm. Mm.
So I don't think there is an error here.
Yeah, my mistake that I didn't read the scenario well because I read showed evidence of malignancy on the
Yeah,
biopsy.
yeah, yeah, yeah.
Yeah, this is my mistake. Yes. Mm. I'm actually
But
having this
overall, you
mistake
did
frequently.
well. Yeah,
Mm.
overall you did well, and I feel like you calmed me. Like it's supposed to be an angry more than that, but yeah, but you did very well. You did very
Yeah,
well. You did very well.
thank you. Thank you.
Yeah, thank you, Dr. Najla, for the comment. Uh, let's start, Dr. Salma, from the beginning because you miss a lot of points here. First, in the introduction, I think you asked about the name of the patient.
Mhm.
Yeah, it's allowed to do, but better to mention by yourself. Are you Mr. X and you are the son for Mr. Z or Mrs. Z? Then
Mhm.
Mm.
her age is according to what's written in the scenario. In if you forget, it will
especially in
not be.
error,
Yeah,
especially in error,
yeah,
and in
yeah. He's
bad
angry.
news. Bad
Yeah.
news. Just to make sure that you are sure about what the patient you talk to about. Because if you
Mm.
deliver the bad news, she will say, "Are you sure, doctor?"
Mm. Mm. Mm.
Exactly. Yes, as Dr. Aish said. So
Exactly.
yeah, you
Mm.
have to be sure by the name first. If you are not sure by the name and you ask him what's your name, so you might be wrong for the delivering the news. Yeah, I believe it's very important to start confirming the data by yourself, not asking. Only leave it if you forget under severe stress you forget the name or you didn't write the name. But always train yourself to write the name and the age.
Or it is hard
And
name. If you found yourself can't spell good the name, it is better to ask about the
Mm.
name better than to say wrong. This is for UK patient. In I think in here in Arab country it will be easy name. But
yes,
if
exactly,
difficult name, you can ask.
exactly.
Okay. Okay.
Okay, then the next of kin, you didn't confirm in this patient. Are you the next of kin? The permission as well. We have permission from your mother to talk about her condition. Then the background, as you did, and the expectation.
Mm-hmm.
I I- I think this is the introduction, and it was okay. Now we'll
Mm-hmm.
go to the task itself. I point already to the scenario in the WhatsApp that
Mm-hmm.
there is underlying. What's written in the scenario is clear, no evidence of malignancy. So you have to trust the scenario, whatever the it's written or after that happened. It was written no evidence of malignancy clearly. So whenever
Mm-hmm.
you do, just to do confirming that it was clear no malignancy. but you started to say, "I'm so." I think yes, you misunderstood the scenario because
I
you.
didn't read. I
No
didn't
problem.
read. No.
It's okay. We are learning now. We are
Yeah,
learning now.
I read
It's okay.
evidence of malignancy on the biopsy. So
No
I took
problem.
it like a medical error from the GB and I activated this immediately.
Yes.
But it wasn't a
Yes.
medical
Exactly.
error because it's no evidence. Yeah.
Exactly.
My
So
mistake.
after that, you can do many sorries, but without apology. Even you are not sure
Mm,
about the GP, don't say, I will correct, I wasn't there. This word really it irritates the surrogate. When you say, I wasn't there, and I wasn't around, I don't know about it. No, the best way to say, I'm so
mhm,
sorry what happened to your mother, and we are here to support her. Try to roam around, but don't be clear that I wasn't there. Or you can say we have to revise her file or records, but don't say I wasn't around, I wasn't there, I wasn't with the GP. Okay, better
okay.
yeah, avoid these words. So what you will do? I'm so sorry for about your mother suffering, and I will try my best to help you, and I will try also to read your mom file or records, and to be sure what exactly happens or what
Mhm,
happened between you and the GP. But don't say I wasn't there at all. Okay.
mhm,
This is for the action. After that, you will do the scenario. I think easily. But the main task here it's not an error, so don't apologize at all. Be sorry, whatever, how many times, but don't say it's an error or to do follow up of the steps of the error because it's not
mhm.
an error at all. There is similarity of the presentation, yes, but the GP did the best of interest. They did everything and it showed no
Yes.
cancer. However,
Yes.
after that, yes, sometimes, and the 8 months is long time, might
Mm,
happen metaplasia or some cells become cancerous, but
mm.
it can take this time to be a cancer with spreading. But
Yes, especially esophageal cancer.
exactly, rapidly grows
Mm. Yeah,
or
very
rapidly
gross.
growing. Yes.
Mm,
So no error at all in this scenario. You have to defend and try to calm him down. Even you can talk to him like I will try to do my best to know what exactly happened there, but don't say I wasn't there because he won't and he needs someone to explain to him about what happened, and he needs someone to support him and his mother as well for
mm,
what's happening now, what's ongoing now. Someone asked about advance directive. I believe you cannot or you can postpone this meeting because in this meeting because already he has shocking news and he's thinking there is mistakes. I don't think you can ask. However, if you have time, you can do it because his mother have now metastasized cancer. And try not to use the jargon, Dr. Salma. You use a lot of jargon. You said malignancy and you said CT, yes. I think also you said metastasis. So all these words you can replace them to
I don't know.
malignancy, a cancer, metastasis spreading, and the CT imaging or scanning.
Mhm, mhm.
Yeah, that's it. And at the end, don't repeat this or don't ask him, did you understand? Or can you repeat for me or you recap? By the way, also you kept talking
It's a
for.
consolation. It's a consolation, not a recap. Consolation means you will repeat for him the management
No,
plan only.
no need, because there is some doubt here about the management plan, the delay of the management, the delay of
Yeah.
diagnosis. Yeah, so don't
Mm,
let him feel more regret that he had this meeting with you. Better try to support him till the end and reassure. I know it's not reassuring things, but don't worry, we will help your mother as much as we can. The group of doctors. If you have time, you can ask about advanced directive, yes, because
Yeah,
she might be
I
unable
yeah
to
because
express labor.
yeah,
Yes,
I like the way. Sorry if I'm
yes, go ahead.
talking. I like the way you managed like the medical management, like, and the way you ask me, do you want me to explain to you how we will deal with this further? I find it very nice as an angry son. That yeah, it's really a good way to explain it, and you explain the plan very nice. Like a group of specialists will be looking after your mom, and they will formulate a plan for her and such things. The issue of advance directive, I don't feel like it is appropriate here,
Mm.
because it's just like it's only diagnosed, it's just diagnosed. So the patient needs to be looked for by the oncologist and the like the MDT team to decide for the further management. Like raising the issue of advanced directives and such things might give the impression that the patient condition is terminal and no cure and all these things, and we don't know about those things. Although it is mentioned it's metastatic at the moment,
Mm-hmm.
but we don't have like a plan from the specialized team or the MDT team. So I don't think it's appropriate to raise the issue of advanced directive at this scenario. And on the other hand, as Dr. Basim mentioned, I don't think there will be enough time for you to do so. The patient is angry, and you need to explain a lot of things. Yeah, that's all.
Okay. Thank you.
Yes, I
Thank you.
agree. Thank you, Dr. Najla. And very nice comment and scenario, by the way. Both scenarios
Yes.
are uncertain. Always be ready for uncertainty scenario. How to deal with, be uncertain as the scenario is. I mean,
Mm-hmm.
if it's not clear that it wasn't a cancer and something happened, so also be sorry. Try not to be clear, this is a mistake, and also not to be clear about the management plan because you don't know what's, as Dr. Najla said, nothing written about the management plan. If it is something for palliative, don't mention because it's not mentioned as palliative. You don't know what is the stage of this, although it's yes spreading to lymph nodes, but still the plan or the management plan is not clear how and what to do and how to deal with this type of cancer. Be uncertain in the management plan. Try to reassure and to tell him we are here to help your mother. To will do our best to give her the maximum support she needs, and so on. But the clear management plan, if written, you can explain and you talk about. If not, don't give clear plan. And the task, if there is palliative possibility, they will write for you. Talk about palliative. I like, yes, as Dr. Najla said, I like you didn't talk about these things, like palliative or whatever. Yes, it's not, it's advanced one or metastasized one, but it's not written about palliative, so no need to talk about them. Especially, it's not yet staged or categorized as the stage of the cancer. Any question, Dr. Salma, about the scenario and the previous?
No, thank you. Just the advanced directive in this scenario would be look inappropriate and
I
like
guess so,
Dr. Najla
yes.
said, yeah,
I guess
because
so.
you are uncertain about that. We delay the diagnosis, and she got spread, and we are telling him also we are going to kill her.
Yeah,
This is
I,
completely
I guess so also.
inappropriate. Yeah.
I guess this is not the time to talk about it because it's just now you know about the result and there is a doubt about delay management and delay diagnosis. So don't give him two shocks unless everything finished and discussion already finished and you have a lot of time, nothing to be discussed. So don't recap. Better to ask about if your mother wish something or express something like this. Don't say advance directive and anyone
Yeah.
take a decision. If
Actually, I
you,
was
yeah,
doubting. I was thinking if we should ask about social, but then I prevent myself because of the same thing. It will be inappropriate to ask about
exactly.
smoking, these
No,
things,
no,
while the scenario is uncertain and uncertainty and also breaking bad news. So I avoid asking this, and I stuck only to with whom she is living and financial
perfect,
support. These things also.
perfect. And this is the fourth lesson for today. If the scenario is uncertain, be uncertain. Don't give clear management plan, clear answer, clear uh, like reaction. Be uncertain as the scenario is. It's uncertain here. What we don't know, they didn't write for us what to do. Unless they wrote, go ahead. If not, be as you did, Dr. Salma, and try to give and support and talk about management plan, sorry, management team, group of doctors, but don't say what will be the management clear. If he asks you even clearly what you will do with my mother, I reassure you that we will call a group of doctors. They will sit and they will review your mother file. They will give her the best interest for her management plan, which is you didn't mention. Just reassure him that we will give her the best interest for her management plan. Okay, this is the best way how to be uncertain, and we have to learn how to do this nowadays, because all scenarios or most of scenarios nowadays like this, it's not clear plan, not clear cancer or error, not clear the action, the explanation, what the negotiation. You don't know what he will tell you. Okay, be ready for all this. Okay, any question else for both scenarios today?
Assalamu alaikum, Dr. Bas.
Alaikum salam, Dr. Azhar.
Alhamdulillah. First thing is, can you share the first scenario? Because I joined very late
Yeah, we will share it. I think we share
in
it.
the group. In the
Yes,
group.
I will share it to the group.
And second thing, there's a second scenario. We will deal it as a breaking bad news or
In the second scenario,
yes.
yeah, should be, because it's a cancer. Yeah, we have to.
It's breaking bad news and uncertainty, both.
Uncertainty
Because
for
for
the
delay, yeah, he will raise the concern that it is delay. Actually, I dealt with this in fault way because I read evidence of malignancy. But you should answer that we will review her file, like Dr. Basim explained.
بس
يعني the scenario in the end is very clear. يعني now after discussion I came to know it's easy scenario.
بس شغلة واحدة بدي أصلحها. مصطلح ال uncertainty ما يستخدم هون. هون أنتو you are certain، مو أنتو قلتوا ما في error.
yeah,
You are
yeah.
certain there is no error. هون يقال perceived delay diagnosis. What is the meaning of perceived delay diagnosis? It means that the relative is wrongly perceiving that there was a delay diagnosis, which is not the case according to my card. So we don't call here, the scenario here is not uncertainty. And when I talk about uncertainty, this means I should go back and check whether the GP has missed any step in the management. And I'm not certain if he did his job completely and excluded the cancer, or he was able to confirm that there is no cancer. So I will mention uncertainty if I'm doubting the practice of the GP. But if I'm not doubting the practice of the GP and there is no error and I will not deal with it as an error, so I will call this scenario perceived delay diagnosis. And I will try to change this perception of the relative by providing him all the steps which was done by the GP and it was correctly done by him in order to achieve the diagnosis. Okay, but somehow because of the difficulty of the cancer, it was a circumferential cancer from outside or some kind of rare cancer. It was missed, not because I missed a step. So we call it perceived delay in diagnosis. تمام. Here we
You are
don't
right, Dr. Hind. Dr. Hind, you are absolutely right. I read the scenario
لا أنا انتبهت عليكي
wrong.
No,
إنك
no,
قرأتي غلط. بس
Yeah.
حتى لو
No,
استعملتي
but
كلمة
then
أنت لو استعملتي كلمة uncertainty هون أنت
Dr. Hindu, we are
بتنقصي.
not talking about uncertainty as an error. I am talking about the management plan, because we open this
هي الشغلة
point.
الثانية اللي
Yeah,
بصراحة أنا يعني I
there is
don't
no
know why
error,
you got.
there is no uncertainty. Right. You are right. You are absolutely right. If I read the scenario right, I would do it like you
Yes,
said.
so there is
There
no
is no error,
uncertainty.
there is no
Yeah.
uncertainty, yes, because the GB, as Dr. Najla also explained, did his best in the best interest of the patient.
And
Uh,
we will discuss
yeah,
a point لأنه ترى السيناريو I don't know who wrote it, but this is يعني the scenario which I know, which was mentioned by those who went to the exam, was not like this. هذا السيناريو ملعوب بحسبته. يعني مغير، هو مو هيك السيناريو. أنا مرتين سمعته من ناس عملوا الامتحان. Once كمان was done by Dr. KJI. It was not like this. We will discuss what was the original scenario just for your information. لأنه هذا السيناريو صعب. It's not an easy one. So it's good to know الأوجه اللي ممكن يجي فيها، يعني how many variety of the scenario is there. تاني شيء guys, there is million of يعني I didn't want to interfere لأنه I felt you are too much into mentioning إنه there is no management plan in the scenario. How many scenarios did you pass through, be honest, where there was an advance إيمو البداية، انسوا البداية إنه it was a delay to 6 months. How many scenarios we did it was cancer with mets and there was no mention of the palliative and it was a palliative scenario.
Yes, we did it a lot, Dr. Hind. But here in this
Alhamdulillah,
scenario,
Allah
yes,
يسعدك. It was
you're
never, it
right.
was mentioned. We
But
never did a scenario يا جماعة مكتوب فيه advanced esophageal cancer with mets to the to the celiac node and spleen. يعني في distant metastasis. هذا stage 4 بامتياز بغض النظر عن type of the cancer or whatever. لأنه if you took a TNM classification, you
yes,
have T, you have N,
but
you have
yes.
M. صح؟
But
فit is
in this scenario, particularly, there is a doubt about the delay. So I don't want to go through the
اصلا ما
advanced
في doubt
management.
about the delay. انتوا بديتوا بالسيناريو لما بتقول when you لما بتتبنى فكرة حافظ عليها. انت you said no delay right ولا لا؟
Yes, it's clear, but
خلص لكان
there is
خلص
doubt
لا
from the
ما بنقدر
surrogate
نمشي
himself.
بخطين متوازين. يا بقول هذا delay وبعترف و I initiate investigation، يا بقول ما في delay وبتعامل على انه new diagnosis of cancer و I give management plan محترمة. أنا now I'm dealing with metastatic esophageal cancer TNM الثلاثة positive في lymph node وفي distant metastasis وكاتب لك إنه الكانسر واضح إنه من السي تي إنه it's advanced 1 يعني و they missed it أصلا. يعني it was there before لأنه البرزنتيشن القديمة could be related to the initiation of the cancer. could be ولا not, it could be still لأنه البيشنت presented to the GP و he didn't improve بالبي بي اي. معناتها البي بي اي it was not the appropriate treatment. So I don't know since when this cancer was there. So I'm dealing with an advanced cancer. There's a big possibility. ف I just interfered مع انه ما شاء الله يعني كلكم انتم وافقتوا على موضوع انه ما في palliative. بس if this scenario was given to discuss the palliative and you missed the palliative, your judgment will be affected very badly.
Yes,
It's, I'm
yeah,
not
I
telling
understand your point, Dr. Hind. You are absolutely right. But in this scenario, it is to explain the findings. We are just explaining the patients that we
طيب
discovered.
هذا هلا انا
It
هذا
is
معك. هذا انت
CT
ليش هقول لك
and
هلا
the
هلا
patient,
حاحكي لك
yeah, and
السيناريو
the
كيف
son
اجى.
is really very upset. So I don't believe it's wise to discuss about
بس when
palliative
I
care.
will mention about when I will tell the patient if I will open the door and tell him do you want me to tell you what we will do for your father from now on,
Their
then
father
I
will
have
be managed by multidisciplinary team and they
تمام.
will sit with you and will update you about the plan and then we can speak about palliative care. But I believe it is too early.
Yeah,
Yeah, it's too early now.
I will add
Too
just one
early, as
point,
if you
Dr.
are
Hind.
hiding something.
Dr. Hind,
At least I
not
will tell him
hiding.
supportive
Dr. Hind,
treatment. يعني because
Dr. Hind,
you shouldn't
not
give a hope.
hiding.
Excuse
Just
me.
listen to me. Just listen to me, because I think this is the decision of the team.
Yeah, yeah,
If
yeah.
you
He
jump
told you,
and
he told you
decide by
to do the
yourself,
task and
Hmm?
discuss about further management. Guys, the
in-
task. Otherwise, why
I
I will
think
tell you to discuss
it
about
will
the
it will
management.
be another blend and another scenario, Dr. Hind. It will be another scenario
حلو،
apart
أنا
from this.
هي
Yeah.
النقطة
Maybe
بوافقك
Excuse
yeah,
me,
عليها.
there is
لأنه
mistake
هذا
and
السيناريو كان جاي
guys.
قديم. هذا السيناريو كان جاي وقت كان في 14 منت.
Mm.
أنا ما
okay,
سمعته ما
yes.
سمعته هذا السيناريو تكرر من جديد لأنه
No,
في
no, I don't
multiple
think.
tasks.
Yes. Yeah, I don't think because
عنده
it's
multiple tasks.
either to
Excuse me.
argue and negotiate or to talk about the management plan. But both in both scenario, I don't think. You're right, Dr. Hind. Yes.
Excuse me all. Hi. السلام عليكم.
وعليكم السلام دكتور داليا. Go ahead.
ازيكم؟
هاي
الحمد
الحمد لله.
لله.
طيب أنا هحل لكم
أهلين
الحاجة دي.
أهلين. welcome
هحل
welcome.
لكم الحاجة دي لأنه أنا I've asked the examiner okay يعني basis examiner عن الحاجة دي
But in
ووريكم
English, Dr. Dalia, please,
طيب
because
أوكي
we have
طيب
yeah.
from the start
Okay.
عشان نلطف الجو شوية. طيب
Okay.
from the start
I have two golden advice. Okay. The first golden advice, this is for Dr. Selma and for all of us, because I've fell in this mistake before. Read the scenario many times, digest the scenario, read it many times, and yeah, and feel what the scenario is. How this scenario, okay? Digest the scenario, read it many times, and can't bother by the name and everything in the scenario. Just write the name and the second golden advice. It's better to let the surrogate guide you, okay? And at the end of your all communication scenarios, at the end you will find that really in the exam, the surrogate, okay, the surrogate will guide you. You can put this any communication in just as we, yeah, the mentors try to facilitate things for us and give steps, and this is not really the exam, okay? At the end you will find that the surrogate will guide the scenario, okay? And how to deal with things, it will come by practice. Yes, I want to highlight something in this scenario. Whenever you have whenever you have diagnosis, you have to have a plan of management. Plan of management, if it's 100% agree with Dr. Hind, and I've asked the consultant about that because we have discussion about this. I'm not sure when in this platform, okay? And frankly said to me, whenever there is advanced metastasis in the scenario, you have just to highlight, not go deep in palliative management. Just highlight in one sentence. Whenever there is advanced metastasis, just highlight about that. For example, you could say, after you breaking the bad news, whatever the way you breaking the bad news, and you said, for example, it's sorry for to let you know that, or it's now advanced cancer. That's mean there is no cure, okay? And the most, but we have a plan of management, okay? And this plan of management is to just read the symptoms. You have to say something in your way, okay? But you have to have this yet whatever the sentence, you need to say the plan of management. You have to mention not palliative and not to say palliative management and what the palliative is meaning that, no, just to highlight this is a non-curative cancer as it's now very advanced, and the aim of treatment is to treat the symptoms. And we have a specialty, multiple specialty doctors, okay, could deal with that. It's a holistic management, okay? We will deal with everything, that to make them to everything you could say, okay? But put that in your mind. Whenever there is this, they will minus you. They will minus you a lot, okay? If you didn't mention just a hint about it's not curable, and it will be a symptomatic treatment, okay?
Okay. Okay.
This is one thing. And from the start, Dr. Selma,
Mm-hmm.
yeah, for example, if I will, because the good thing is diversity of doctors from everywhere in the world. They could accept if you just ask a candidate about their names, or just confirm the identity himself, or ask whatever, okay? But the one of the important thing after, because this is now it's updated, I'm not sure how many months ago, just please read the mark sheet for communications, okay? That they
Mm-hmm.
put, you need to ask how the patient is now. You need to check how is he now, how is she now, yeah, the mother.
Honestly,
Yes,
And
are you
mother,
talking
yes.
to the mother or to the relative? Ah, okay, to the
Yeah,
patient.
you need
to the
to
son.
just
How
to
is your
check
mother now?
how is your
Yes.
mother. This is
Then
when
if to
Yes.
the mother, how is your
Mm-hmm.
in case
how's
you
she now, okay?
establish
How is,
therapy?
yeah, this is one of the question is updated, so you will get mark for this. Please don't forget that. Okay, check
Okay.
the mark sheet after they update it. Okay, and
Okay.
after you finish the this, there is something also I've noticed in your, the surrogate said to you, I want to know what is wrong, and you just reply by after expectation, and you ask how, what do you expect from this meeting. So this here is you are not listening well to the patient, the surrogate,
Mm-hmm.
I mean. So you could say,
Mm-hmm.
do you have any other queries about you need to know after this, for example, after this meeting, because you know already, you will let her know that you know she want to know the diagnosis or what is going on
Mm-hmm.
about the test. Okay, so give her the impression that you, and you got what, and you are good listener to her. Okay, so if
Okay.
you just keep like you just, yeah, you just you know, this is step I want to ask it, no, it has to be a game of I'm good listener to you. Okay,
Okay.
and after that you said I know that you know you want to know the diagnosis and so on, and just I would like to, because this is the mark here, are you
Mm-hmm.
listening well to the surrogate or
Mm-hmm.
no? And this is the
Mm-hmm.
rapport between you and the surrogate. Okay, so
Mm-hmm.
and then after that, when you come to the breaking bad news, you just mention you want to fill the gap the surrogate didn't tell you. I got you well, yeah, you
Mm-hmm.
will.
Yes. Yes.
Yes, and the it's okay to do that, but you didn't ask her, am I right? This is good.
Mm-hmm.
This is important point here, Dr. Salma.
Mm-hmm.
Okay, you've mentioned points that the surrogate didn't mention to you.
Yes.
Okay, so you need after this point to say immediately, am I right? Is that right? Okay,
Oh,
and
okay.
if there is no, sometimes there is many details you didn't need to mention. Okay, in this case, your main thing is to deliver the breaking bad news about the
Mm-hmm.
advanced metastasis. So, why you want to put you in trouble with the surrogate, and that the went to the GB, and then the GB let her guide you. Okay, if she
Mm-hmm.
didn't came across that things, why you put yourself in trouble, and to explain
Mm-hmm.
and to clarify things. Okay, then the second step, if you say, okay, I'm sorry, I have just break the bad news as there is no many details. But when the surrogate asks you, you already digest all the scenario, so you can
Mm-hmm.
answer accordingly.
Yes. Yes. I
Okay, then
understand
you
you. Yeah.
just, yes, yes, as you know, that is give the bad news immediately without any, and just try to, this is the food pipe, and try to this a food pipe, and the here explain the diagnosis, and they find that just give some medical information. Okay, this
Like
is here,
drawing.
this is
If I
yeah, they
was
found that,
concentrated on breaking bad news, I would, yes, draw for
yeah,
her
could I
that this is
explain
a
the
food
diagnosis for
buy.
you? Yeah, this
Yes.
is a food
Yes.
pipe, and they found there
Mm-hmm.
is cancer, and I'm really sorry that
Mm.
give a pauses, because this is not only cancer, this is advanced cancer. So you will give
Yes.
first pause that you're breaking the news. Okay,
Mm-hmm.
then,
Mm-hmm.
and I'm sorry that the cancer, they found that the cancer is already spread to other part of or other organs. So
Mm.
sorry. So what do you mean? Let the patient, just you guide the patient to the area that you want to. Okay, then
Yes.
what do you mean? Is that curative and so and so and so? I'm sorry, that's mean that's already advanced and already spread it. So it's, I'm sorry to tell you, this is, there is no cure for that. Be certain. Okay,
Mm.
this is
Mm.
no cure for this. The examiner mainly waiting to mark you for clinical judgment on this word.
Mm-hmm. I
Okay,
understand you very well, Dr.
no
Ayla.
cure.
Yes.
Okay, but
Mm.
actually that's, we didn't mean that we leave your mother alone, and so and so, and very nice
Understand.
plan of management that you've mentioned before. Okay, just put that, because there is marks for it to be systematic. If you read the mark sheet, it's to be systematic. Okay, and then that we didn't, and then mention all other steps. Okay, and for the social history, I have a comment about when you said, do you need any financial support or so. This is not actually here the practice. Usually, you will ask what usually, because the system already support them. You could ask in a way that, is your mother taking care of any other? Because for example, if for example live with her husband, and the husband has, for example, dementia or something, and she's taking care of him, or the mother has a son or a daughter with disabilities, or something else, someone other depend on her, she's taking care of them. Okay, you could ask, are you living with your mom? Okay, who is take care of her? Because here, if she's living alone, there is some for the future might need for carers. Okay, or if she is not well nowadays, they could offer someone to take care for whom he is taking care of. Okay,
Okay. Okay.
this is the
Okay. I
point
understand.
mainly here. So it's not better, is not to ask for financial. This is not usually the word
The practice.
the practice.
Yeah.
Okay, so mainly who is taking care? Sometimes maybe a doc. Okay, and she's just ask, do you need any help from our side? Or just, if you don't have time, just say, do you feel your mom might need any help from our side? Okay, if she said yes, yeah, okay, and then we'll then
Involve the
don't give,
social then. Yeah.
yeah, don't give a false promise. So you could say, no, we'll do that, we'll do. No, we will liaise that with our social team. Okay, or we contact our social team for that. Okay, we'll see what we could do for her. Okay,
Okay.
because sometimes it might be busy system, or no, you can't guarantee. Okay,
Okay. Okay.
yeah,
Okay.
that's
Understand.
all points that I want to mention. Thank you.
So I understand now, that Dr. Dalia, that when I break bad news, then after that I will explain the disease. Explain the disease. There is clinical symptoms, drawing clinical symptoms, and management plan. Management plan. I should tell her, and I'm sorry that it is an incurable, and the aim would be to treat the symptoms rather than to treat the disease. Now it is a spread, because now it is a spread. This is how I mention palliative without mentioning palliative, right?
Yes, you got
Yes,
me.
I understand. Part of explaining the disease, part of explaining the condition now.
Yes.
Okay. Yeah, I
This,
Yes.
understand you now well. Yeah.
Yeah.
Thank you, Dr. Dali. That is a very valuable addition and very clear from your side. Thank you so much that you give us also from your time.
no,
Thank
just please, golden
you.
advice. Whenever you
Thank
have
you.
a disease, you want to have a plan of management for
Mhm.
that, even if it's not mentioned. Because
Yeah. Okay.
if you think, when you have a meeting with a patient or family or next of kin, what they want
Mhm.
to know what the
The
diagnosis,
management.
what the plan.
Mhm.
Okay,
Yes, that's right.
this is
Yeah.
the main thing you would like to
Mhm.
know about, what the next step, what the plan. You will input her for follow up. You need to mention that, and
Mhm.
she will be on follow. By the way, if we
Mhm.
look carefully on the scenario, we'll find that the GP did everything he could
Yes.
Yes.
do.
Yes,
Yes.
exactly.
If
Yeah.
it's there's
Yes.
something uncertain, why the
Well,
biopsy, the first biopsy was negative and the second biopsy was positive, this is you don't know. because if there is any difficulty, if there is any, for
The second
example,
biopsy
wrong
also was negative. The
positive,
second biopsy also
was negative. We don't know why.
negative also.
We
Yes,
don't know
was
why.
negative. Yeah,
Yes, we
yeah,
don't know why.
yeah,
Okay,
yeah, yeah.
so but the GB has no, he did all the investigation he could do
Yes,
according to his
Yeah,
the pathway
we
that
agreed
yes,
his
for that, Dr.
guidelines.
Dalia. Yeah, we said that it's not an error at all. We
yes.
talk about the management plan, which is not clear in this scenario, but Dr. Hind added, like, yeah, we have to open the topic of palliative, but not mentioning the palliative, as you said, Dr. Dalia. Yes, we agree for
No,
that.
Doctor. No, now I understand from Doctor Daria, Doctor Basim.
Yes,
She is not suggesting to go through the palliative like usual.
not in details.
Do
Yeah,
you
as
want me?
the
Do
same.
you want
Yes,
me to discuss palliative? Do you want me? No, just as part of Breaking Bad News, you then. Part of Breaking Bad News, you will discuss the disease, you will discuss the condition. Part of discussing the condition that you are going to draw and talk about the disease spread here and there, and
yes,
then the management plan. Part of it, you will say that it is advanced and spread to all organs. And I'm sorry to tell you that the management plan will not be based on curing this, because it
yeah,
is
not to
uncurable
cure her,
now.
just
Yeah,
to help her.
it's only
Yes,
to release symptoms, and this will be done by a group of specialists who is
exactly,
like this, and complete your sentence.
exactly.
Yeah, I
I
Okay.
got her
believe
idea.
Doctor, yeah, I believe
Okay.
also Dr. Hind want to say this message, and I think also Dr. Dalia, the same concept. So
Yes.
we just got the information by different way, but both of
Mm.
them and all of us agreed for how to manage, and this cancer is not a curable one.
Yes.
Okay.
Yes.
Okay. Just
Yes,
you got me right, Dr. Selma,
Mm-hmm.
but please, the skills of how to say this word, try to practice
Mm-hmm.
on that. Don't rush to
Okay.
say it. It's this is a concept, but actually during the conversation between you and
yes,
the surrogate, you need to be like pauses, like
Yes.
you know,
by
just
the way,
give, and then he will ask you, what do you mean that there is no, what do you mean that he will die, and then many concern will
yes,
hit
exactly,
it you. Okay, so if you said this is really, so tell you that this is the results show that is a cancer of it's or say مثلا this is food pipe cancer. So many yeah, most of the time people they want to know where is exactly the disease, no more details. This is a
Mm-hmm.
disease of liver, this is disease of food pipe, this is a disease of lungs. This is most likely they want to know where is the disease. Okay, and it could
Mm-hmm.
be it's infection, it is cancer, then the pathology for one word. So don't yeah, consume or waste your time on
yes.
explaining many things that some mentors, for example, want to be
By
take a long time to explain and
by the
where
way,
and
Dr.
so.
Dalia,
Yes,
you're right. No more surrogate, or you are not the one driving the scenario nowadays. They are the surrogate, the one doing that. They have a
yes,
lot of concern and instructed by the examiner. Please fill the time with this concern. Don't let him talk. We are doing here like conversation. We no, there they are the one driving the scenario. Don't think that you will go inside to explain and to draw. It's not like that. They always fill the gap, as Dr. Dalia said, and the time with a lot of concerns. You have to
Mm-hmm.
answer and to address his concern, and in between, you can fill and fulfill your task through the scenario. If you have clear task, do it as soon as possible. You have the opportunity to do it. This
yes,
Mm-hmm.
is yeah. This is the clear way how to do the communication nowadays. Really,
yeah,
they
Yes.
have a lot of concern.
yeah.
Okay.
And the last thing, sorry, Dr.
Yes.
Basim,
Yeah. Yeah.
is,
Yeah.
for
Dr. Dalia.
example, to be systematic is that to deliver the news, to have
Yes.
the
Exactly.
pauses, and to
Golden
give,
silence.
let him
Warning shot. Yes.
digest the new. Sometimes give him 2 seconds or so, just to absorb the news, okay?
Exactly.
And
Yes.
then again, okay, and the other things for example, if it depends on his reaction, okay, and how he's dealing with that, and then or it's already metastasized or not metastasized. This is already spread to
Yes.
distant organs, and now it's very it's advanced.
Advanced
Okay,
one. Yes.
let him to absorb this, and then he might cry, he might do something. So he has his own scenario. So let
Exactly.
him play
Yes.
his role and play
Yes.
your role.
Yes. You're right.
Okay. And when you would like to explain, would you mind to explain more about his condition? Okay. If you, this is the cancer now, it's they found by the scans. Okay. They found that it's from out, they found that the cancer, it's here in the food pipe from outside, and they already went to the
And Dr.
his tummy
Daria, sorry to
organ.
interrupt. And this also would be a very good point to hint for him that the GB didn't fail to see the cancer because it is from outside, like Dr. Najla mentioned also. It is from outside so that the endoscopy cannot see from inside, and the biopsy did not detect it. Because it is in the CT, it is from outside the esophagus, and then it is spread all over to the liver. By drawing and explaining, you can also justify the why the delay, or why there is a delay.
Exactly. And the surrogate was waiting for you to mention this,
You mentioned
to
this,
jump
yes,
and
yes.
say
So
why the GB didn't order
Mm,
this scan earlier. And here
yeah.
you will come and defend the GB, like the GB did all the steps, and any doctor in his position will do the same
okay,
steps. But
Mm.
again, I can discuss with them and came
okay,
back to you. But yeah, defend the GB.
okay.
Mm.
If
Mm.
it's there is a concern like that, for example, if the patient, I don't know, he has, for example, dysphagia, or he has indigestion or something, that if ask you why he didn't ask for the CT scan from the start, and so on and so on. Okay, this really a good question and very sensible question, but actually usually when there is a guidelines for the treating people, we have to be we have to follow them. Okay, if for example from the start he just came with that and that, we need to see if from inside, because it will give better view from inside, even from outside. And this is rare, it's not common that to have this from outside, as the scan showed. Okay, so if you try, when you explaining the disease, please, because there is mark for be systematic, try to just, this is the disease, this is the area, and you have this information in your scenario, and you actually you don't need to mention the GB unless the surrogate ask you about that. Never
Yeah,
ever try to come through the scenario as no GBs, no nothing, just the result with me now, and it showed blah 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 blah. And if he hit you up by any concern regarding the GB, at that time you could answer him. Okay, and try to be like, this is the clinical judgment here, marks. How do you answer kind of this question? So this is for example, if dyspepsia, or if with loss of weight, they will do endoscopy from inside. This is unusual to be from outside, unless we want to do a staging or something, because there is something unusual happen to this patient. We need to see the whole things by CT scan or something, or the scans of the tummy, okay, on the chest. Uh, just try to be very simple and systematic, and just short information. Okay, and try to avoid any jargon, Dr. Salma. Thank you.
Thank you for
Thank
you.
you, Dr.
Thank you.
Bada. Thank you.
Thank you,
Thank you
Dr.
so much.
الله
Thank you.
يسلم الله
Yes,
يسلم
Dr. Helen.
ايديكي،
Yes.
يعني عن جد عن جد اني سمعت كل كلامك كلمة بكلمة، ويعني تشكري، لانه the idea مثل ما قال دكتور باسم it's not to prove my opinion or not. guys انتوا هون كنتوا تقريبا اول ما دخلنا نحكي 25 شخص، كل واحد منكم يوم من الايام حيدفع الفيز وحيروح وحيوقف بالكوميونيكيشن ستيشن he might repeat the word he
Yes,
practiced,
exactly.
and he either will cry
Yes.
ويعني لا سمح الله يكون في بقلبه غضاضة علينا، لأنه نحن كنا عم نسمعه وعم ندلي برأينا على أنه نحن ناس عم نساعد، أو حيدعي لنا ورب العالمين شو بيقولوا من سن سنة فله أجرها وأجر من عمل عليها، نضل عم ناخد أجر كل الناس اللي ساعدهم بعد ما نجح بالامتحان.
Exactly.
فبالنهاية it's not about proving or like proving my opinion or something، بس my advice always listen. يعني if someone other than me X من الناس دخل وقال لكم ترى هذا كانسر و you should mention البالياتيف ولا whatsoever، don't fight the idea, just keep it. Maybe in the exam يطلع لكم surrogate حنون وإكزامينر حنون يقول لك دكتور what will happen with me، تروح تقول له أنت MDT we will
Yeah.
sit together، رد لك دكتور what will happen with me، فأنت تلمع بذهنك إنه والله فلان الفلاني دخل اليوم الفلاني
Yes.
وقالنا ترى احكوا على البالياتيف، يعني هلا وقتها. فاسمعوا
Yes.
الافكار، لا تنقادوا وراءها ولا تحاربوها انه لا هي this is a wrong idea. Listen to it, keep it aside, but يعني think of it, you might need it once. الحمد لله
Yes.
اليوم في دكتورة داليا، بكرة بيكون في دكتور فلان، بكرة بيكون في دكتور فلان، لكن أحيانا بيكون في حدا يا حرام مزمار الحي لا يطرب يعني دخل ولحش الفكرة وما حدا سمعها، فلا تتعودوا انكم ما تسمعوا الفكرة. take it, write it، يعني think of it, you might need it one day. لأنه أنا
Yes.
متأكدة دكتورة داليا تعبت لو وصلت لهون وسمعت ناس كتير وسألت كونسلتنت كتير، فمو كل واحد حيفوت على الامتحان حيقضي له سنة سنتين، في ناس بدها تفوت على الامتحان بعد 3 شهور وتنجح.
Yes.
ففهمتوا شو قصدي؟ فlisten, everyone gonna come and give an idea, he will never give it to make you fail, he will give it just to help. He
Yes,
might listen
exactly.
and experience something. فجست keep it aside. don't يعني أنا ما عم بقول لكم لا خلص تبنوها، لا يعني don't adopt that idea, just keep it aside, you might need it, it might be correct somehow, surrogate examiner guide you to it. فوالله تسلمي دكتورة داليا، وشو بيقولوا يسلم لسانك
الله
Yes,
ويسلم
يسلمك.
we
تمك
agree.
وتعيشي تكومنت إن شاء
Really,
الله يعني.
really, we are
Yes.
thankful
Thank you
for
for
both
your
of you.
time. والله
Yes.
دكتورة داليا. Thank you so
والله
much. I
دكتورة
am
يعني it
very
هند،
was
happy.
it was يعني واخدتنا بحلمها هيك وشرحتها بطريقة كتير لطيفة. فيعني بس just an addition ال MDT بالcancer cases you shouldn't say just multi-speciality team as we mentioned the word usual, you should mention المكميليان nurse، لأنه المكميليان nurse has a role whether it's a cancer initial ولا benign ولا cancerous ولا advanced.
Yeah, it's a
فalways in
specialized
their
one.
scheme
Yes.
المكميليان nurse should be heard by the examiner, should be mentioned to the surrogate, and should be part of your MDT. وللأمانة أنت عم تتعامل مع case esophageal cancer and you want to give a management plan which should not look a stereotyped copy paste cliché. ما لازم نستعرف، لازم تقول salt إنه there will be a specialized team، لأنه هذا الإنسان أنا عرفانة عنده esophageal cancer. I know he will have he need a diet advice, he need to have a soft diet, يعني he needs someone to be with him regarding this issue. فmentioning multi-speciality team, that's it. فيعني it's very nice when you sit with the patient and tell him في ناس في specialized people gonna deal with your problem. It's not that we will form a multi-speciality team. I know it's cancer and I know it's an esophageal cancer. I should add some touch to make my management plan special for this patient. فيو can mention SOL team, المكميليان nurse، الأشياء هاي it will support your MDT. وشغلة
Yes.
تانية لاحظتك كتير عم تقولي بغض النظر this scenario is about uncertainty, certainty, error whatsoever. You might come across a situation where you will need to look up the records and you will need to contact the GP. It's not you who will contact the GP. It's not you who will raise the phone and hello GP أنا عندي patient. It's a specialized team. They are well oriented about how to investigate, how to track, how to trace, how to look into the records. So always mention we. تمام. There will
Yes.
be a
Yes.
specialized team who will contact the GP, who will try to collect the records, and when we will finalize conclusion we will come back to you and give you the full feedback. فإتس always not I. Take care of I. لا تتعودي،
Okay.
متى ما تعودتي على كلمة I it will
Mhm.
come like unintentionally and it will ruin up everything. فalways mention
Okay.
we, specialized team, professional people، لأنه كل شيء في إله ناسه، كل شيء في إله الناس المختصة فيه. everything have its يعني team who are specialized professional to complete that task. وشغلة
Thank
تانية
you,
كتير
Dr.
قالتها
Thank you
دكتورة
so
داليا
much.
حلوة، العفو يا قلبي، إنه نحن صار لازم نسأل، وهي شغلة يعني من الاكسبيرينس just to anticipate what will happen with you. إنه if you ask the patient how do you feel today، البيشنت he will not tell you fine ويسكت، ولا tell you I'm sick ويسكت. He will give you some of his concerns and some of his expectation while answering this question. So he will tell you, Doctor, I'm not feeling well. I'm concerned about my mother. She is not feeling good. We had took her to the GP and she was on a medication and those medication are not working and suddenly now she's deteriorating. طب هلا انت هيك بمفترق طرق، هي حكت لك
Mhm.
جزء من الكونسيرن وانت still part of your scheme to ask about her ideas and about her expectation. فشو تعملي؟
Mhm.
you cannot ignore لأنه حيقولوا سكيمك
Address,
ناقص.
yes. You have to address first, yes.
عليك نور. You should tell her, I appreciate your concern. I can see that you are distressed about your mother's symptom and about what happened with the GP. But if you allow me, can I ask you if do you know some more information about your mother condition which you like to share with me؟ بهالطريقة انت you
Okay.
are listening at the same time you are
Share it.
completing your scheme.
Yeah.
You understood what she say, you didn't ignore، بس انت you are going with that systematic way. Don't ask your agenda, don't superride البيشنت talk or don't let him repeat his talk. لأنه لو أنت سألتي what do you know about his condition حتضطر to repeat وكأنك أنت ما سمعتي شو قالت. لكن
Yes,
لو أنت
exactly.
عدتي له شو قالت بشورت فورم وسألتيها is there any more ideas you would like to share with me about your dad condition؟ perfect.
Yes.
تمام.
Okay.
So don't
فيعني
ignore.
Okay.
Yes, don't
هذا
ignore.
هذا اللي حيصير معك. انا عم بقول لك شو حيصير لانه هن بيضيفوا الكويستشن وبعدين احنا نتفاجئ ان السيروجيت يعني he really utter everything he know فانت you are in the middle what to do. فتry to
Yes.
repeat in summary and add your scheme.
Yes.
Okay.
يعني والسوشيال يعني الكلام اللي قالته دكتورة داليا يعني ذهب، لأنه never ever ask about the financial please. حتى بالLCC، حتى بالLCC بأي don't ask about the financial. always ask a very nice sentence, how is your support system؟ لأنه الفاينانس والسبورت at home كله اسمه support system، يندرج تحت السبورت سيستم. ينقسم السبورت سيستم للفاينانس وللهوم وللفاميلي ممبرز ولكله. when you say do you have a good support system, are you well supported، فit cover everything وما حطتك بمأزق انه انت سألتي عن الفاينانس، تمام، اللي هي الماديات، وكأنما السبورت فقط ماديات.
Yes.
تمام.
Mm.
always ask do you have a good support system, are you well supported, is there someone to take care of you or was anyone dependent. فدائما السوشيال هيستوري خليه بهالطريقة. other point last point إن شاء الله إنه
Yes,
الادفانس
last point.
دايركتيف.
The last point, yes, advanced directive, lasting power of
لا
attorney.
هي انتوا قلتوا انه ما هي انتوا قلتوا انه ما هي مهمه، بس شغله تانية
Yeah.
نصيحه بالادفانس دايركتيف واللاستنج باور اوف اتورني. This patient was okay, he was on PPI و eating و very
Yes.
fine.
Yeah.
Suddenly he deteriorate.
Yes.
فبطبيعه الحال it is by default I'm not expecting such a patient to go and do advanced directive and lasting power of attorney.
Exactly. Yes.
يعني انت مو بس ما عم تسأل على advanced directive lasting just because it's not the time. لا هي a
Yeah.
concept.
Because
Never
yeah.
ever raise the issue of this advanced directive in a patient who was surprised by his condition. أنا
Yes.
امبارح كنت منيح،
Yes.
اليوم حدا
Exactly.
اجى قال لي انت تعبان. طب مين حيخطر بباله بهالسيتويشن يروح يعمل؟
Yes.
ف there are multiple reasons why advanced directive and lasting وهذا حيساعدكم انه how to process المايند set, when to ask when not to ask.
Yes.
So
Exactly.
don't ask when there is an acute issue by default. Don't ask.
Yes.
حتى لو
Yes.
كانت هالacute issue is a point which will deteriorate later on. تمام. So it's not the time had a one point it is an acute issue had a second
Yes.
point.
Yes.
تمام.
Thank you so much, Dr. Hind. Yes, very
تعرفونا
nice
على الإطالة.
comment. No, 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 no. Thank you so much. You and Dr. Dalia explain and clarify the things. Always there is doubt, and the scenarios also is not clear. I believe the scenario from here to there and from person to person, yeah, a lot of change happen on the scenarios. That's why also the all scenarios is not clear as we are expecting. But your presence, you and Dr. Dalia clarify the things. Thank you for your time and your comments. Anyone has comment or question before ending the session? I guess
Just
yes.
attached a copy from the communication
Mhm.
mark sheet. If
Mhm.
you could have a look, it will, precipitate.
Yeah, we can share it to the group, right?
Yeah, I already shared.
Okay, perfect. Thank you, Dr. Dalia. Thank you so much.
Okay.
Thank you. Yes, thank you.
Thank you, all of you. Wallahi. Thank you so
Yeah.
much.
Thank you, everyone. Okay, well, thank you, of course, Dr. Najla and Dr. Salma for the practicing today. See you tomorrow, inshallah, with clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.